So this is a 49 years old female, not a known case of diabetes, hypertension, or tobacco chewer. She presented within a 1 hour of a chest pain. She has a typical chest pain, and on ECG there was a ST elevation into 3 AVF and reciprocal changes in the 1 AVL. There was a ST depression from V1 to V3, V4. So this patient is presented with the inferior wall with the RVMI with the hypotension. The BP was 90 systolic. And here is the angiography of the patient, and you can see this RCA. This is with right radial root. This is JR catheter. And you can see the thrombotic lesion, almost 95% thrombotic lesion in the distal RCA. And you can see the abnormal RCA in the starting, the proximal part of RCA, there is a aneurysmal part. And if you see after the stenosis, after thrombus, there was a sort of aneurysmal ectatic part in between. So this is a epicranial view, and you can see the thrombotic stenosis in the distal RCA. So we went ahead with the JR guide catheter. This is BMW PTCA wire, and it took 2 seconds to cross the wire. And there's thrombus. Now the difficult part is to size the stent, because the aneurysmal part is there just distal to the stenosis. So this looks like a 3.5 normal diameter, but in this aneurysmal segment maybe more than that. So we took a 3.5 stent, 24 into 3.5. So we position the stent in this segment, and you can see the stent is swinging in the RCA. So that is a difficult part in this swinging stent, because it was in distal RCA, and RCA is big. So the stent, you can see, moving up and down. It is not stable because of the contraction. So anyhow, we inflated the stent at around 12 atmospheric pressure. Nominal was 8. So just before the bifurcation, we wanted to keep a stent to cover that aneurysmal segment, but somehow stent slipped back. And this is the scene after the stent deployment. You can see there is clearly there is this aneurysmal portion just after the stent. This is aneurysmal portion is being prominent in this scene. So wanted to cover this right up to this bifurcation point, but stent slipped back. And then there's again the cranial view, and you can see the same thing. There was sort of, it seems like edge dissection and all, but there was a aneurysmal part. So wanted to cover that, so we took a decision of putting second stent. So we placed the second stent, and this is the positioning. And again, you can see the stent is again moving up and down, forward and backward, because of this contraction and large size of the RCA. And it was very difficult to keep the stent stable. And then somehow we deployed the stent. Stent was 3.5 into 15, deployed at 14 atmospheric pressure. Nominal was 8. And then overlap done between these two stent. And then this was the picture after the stent deployment. There was a sort of slow flow, but after giving tarifiban it has improved. And this was the primary angioplasty to this thrombus loaded aneurysmal RCA. Ultimately we landed in 2 stent,